we found out you were sick, you were a baby. And then when you found out you needed a transplant, you were 4.
4.
That was January, huh?
Now, do you guys remember the day that you guys received the call to come in and have surgery?
I remember. Mommy and Daddy and Julia were having lunch, and JJ was at school, and we got the call at a restaurant, and I screamed, and everyone in the restaurant looked at me like I was crazy, and I picked Julia up and I squeezed her and hugged her. And that was May 14th is when we got the call, and the transplant was early morning, May 14th of 2008. May 15th of 2008.
And when one night, which I remember, my mom told me, since I was just 4 or 5 years old, I was in the bed with Mommy, and then she told me that we were going to the hospital tomorrow and that she needed surgery, and I kind of got a bit scared that day.
Now, Julie, how has it changed your life to actually have a transplant, honey?
Well,
Let Julie answer.
it was kind of my time doing that, but not my time being alone, because once I was alone in the hospital.
Yeah. Do you remember what it was like before the transplant?
How did you feel?
How did you feel before? Were you tired a lot?
Yeah.
And she used to, at 3.5, 4 years old, she used to take 6-hour naps during the day because she was just too exhausted to do anything. And she would be playing on the floor, and I would walk into the room, and one minute she would be playing, and the next minute she would be asleep on the floor, just in the middle of the room on the carpet, just in the middle of whatever she was doing, just too exhausted to move, to do anything more. So, did you walk the donor dash?
Yes.
And did you walk the whole thing all by yourself?
Yes.
Wow.
And there's no way she could have done that before.
And she doesn't cough anymore, too. She was coughing quite a bit before the transplant, and she does not cough anymore.
Because her heart problems were causing lung damage, and so she wasn't breathing well, and so it's made a really big difference in her quality of life. And when they listed her for the transplant, they put her on IV medication and in her arm here in a PICC line, and she had that in her arm for 4.5 months. And that was what got her while we were waiting, because when they finally listed her, she just didn't have any energy to do anything at all. So getting that IV drip, and we were lucky that we were able to go, not have to stay in the hospital that 4 months. We got to stay with family here in Denver, and we're really thankful to the family who helped us so much during that time. But having that, you can't live your life attached to a machine like that, giving you medicine just to make you strong enough. And seeing her, I remember the morning after the transplant, I walked in the first time I got to see her, and I touched her feet. And I looked at the nurse and I said, "She has a fever." She's like, "No, she's fine." I'm like, "No, feel her feet. Her feet are hot." And the nurse said, "No, she has good circulation now." And prior to the transplant, she would wear wool socks, and I would take wool socks off, and her feet would still feel ice cold because her circulation was so poor. And 10 days after the transplant, she wanted to jump on the bed, and we had to explain to her, "I know you feel good, but you're not ready to jump on the bed." So
That's wonderful.
it was definitely an amazing thing, and we're very thankful to our donor and their family for deciding.
Well, I was really scared during that time. So I usually come in to check on my sister now and often during the night.
Yeah.
She does good, though, doesn't she?
Yep.
Are you thankful to the people who gave Julia her heart?
Yes.
Yeah.
Especially the family.
Well, thank you again
Thanks.
for sharing.
Thanks.